This is a production of WEDU PBS, Tampa, St. Petersburg, Sarasota. Premier Eye Care is a leader in national managed eye care with 4 million insured members nationwide through its network of optometrists, ophthalmologists, and specialists. Recognized for best practices in delivery of care, associate engagement, and commitment to the community. Premier Eye Care is proud to support That's All I'm Saying with Ernest Hooper. For more information, go to premiereyecare.net.
Our motivation every day is the people around us in this community and making better.
Workforce development, healthcare, education.
Getting out there and making a difference in the lives that need it the most.
COVID-19 has had a crippling effect on so many aspects of our lives, but its impact on the ongoing opioid crisis is especially alarming. Tampa Bay has one of the highest overdose rates in the state. An overwhelming number of deaths are caused by a synthetic street version of the painkiller fentanyl. People are taking drugs like heroin, cocaine, and even anxiety medications that are laced with the illicit drug, and they don't even know it, and they never wake up. On this episode of That's All I'm Saying, we'll introduce you to an effort to mobilize business, nonprofit, and faith leaders to address this issue, and we'll hear the solutions they think are possible. But first, the story of a mother who knows firsthand the devastating impact of opioid and fentanyl use. Emmanuel Figueroa's death didn't have to happen.
I miss him tremendously. I feel like he's just always with me, just kind of making me stronger and guiding my steps, you know, making sure that I'm okay.
Mm-hmm.
I think what made Emmanuel special was his fearlessness. He faced a lot of obstacles throughout his life, and he did that with grit. He was diagnosed with kidney stones at age 15. And he was prescribed Vicodin and oxycodone by his urologist.
Those painkillers are highly addictive and led to Emmanuel's nearly 20-year battle with substance use disorder.
Had I had that information, I would have definitely been able to monitor his intake because he didn't want to be an addict. No one grows up thinking, that's what I want to be when I grow up.
Right.
With substance use disorder, it promotes, isolation. He isolated himself from our family.
Emmanuel moved to New York City in his 20s, where he worked and made new friends. His addiction was active during this time, despite several attempts to stop using. In 2019, Emmanuel took a pill laced with fentanyl, a drug that is 100 times stronger than morphine. He died later that night.
It was a crushing of my soul. I broke into a million pieces. I've not been the same since. My mind, my heart has been forever changed. And I look for a time when I will return to my normal self, but I don't think that'll ever happen.
What's your message to parents who might be dealing with a child who has an addiction problem?
I would tell them to be vigilant and informed about the medications that could potentially be prescribed to their children. And then secondly, if you find that your child has in fact developed substance use disorder, I would, encourage them to remain positive in their children's lives, to offer unconditional support, which is what they will need as they navigate their treatment and recovery.
Now Sandra hopes Emmanuel's story raises awareness for other people who may be in a similar situation.
I've decided to use the strength that I've gained through my grief and just kind of let it pull me forward and bring a light to this crisis. If my story can bring about conversation, then I am all in.
Thank you, Sandra. I know you still hold Emmanuel in your heart. Hopefully, it'll make a difference in the lives of others.
During the early days of the pandemic in 2020, fentanyl killed more people in Tampa Bay than all other substances combined. Even today, nearly 30 people die of an opioid death each week. The devastating impacts of this crisis is being felt by families, in hospitals and treatment centers, and in our local economy. Joining me now to discuss the issue and possible solutions are Jennifer Webb, Executive Director of the nonprofit Live Tampa Bay, and Dr. Jason Wilson, Associate Medical Director of the Emergency Department at Tampa General Hospital and an Associate Professor at USF Health. All right, Jennifer, I want to start with you and ask, your group had a different name when it started. It's now Live Tampa Bay. Does that underscore what we're dealing with and how much you want to see more people live and not succumb to this epidemic?
Thank you for having me here today, Ernest. Yes, we did change our name to Live Tampa Bay because what we want folks to do is more than simply not overdose or just to focus on opioids and the problem, which is what our previous name did. We want people to live, to not only not die, but also to live and thrive and enjoy a life, a healthy, productive life.
One of the factors we've talked about with this issue, Jennifer, is the unintentional consequences and the dangers of even taking a single tablet. Can you expand on that a little bit and talk about how people can't take these kind of risks anymore?
Absolutely. So when we talk about people with, when we talk about the opioid crisis, people think of those with substance use disorders dying in record numbers, and that's absolutely true. But there's this entirely other group. Our recreational drug users, our occasional drug users who are also dying in record number, and that's due to one thing, that's due to fentanyl. Fentanyl is in so many substances right now. It's cut into pills, it's pressed into pills, it's found in cocaine and even in marijuana. And actually, a horrifying statistic is that 2 out of 5 pills that are bought illicitly from the street contain a deadly amount of fentanyl, according to the DEA. That means that recreational or occasional drug use can be more deadly than playing Russian roulette.
Dr. Wilson, let me turn to you. As a doctor at Tampa General Hospital and a professor at the University of South Florida, I think you bring a unique perspective to this. How have you seen this epidemic impacted by COVID-19?
Well, just like a lot of other things that were precarious or just on the borderline of breaking, staffing, labor, other social determinants of healthcare, what we've seen is that COVID pushed us really into a even more difficult place than we were before around the opioid epidemic. This opioid epidemic has really been something that's been a part of my career, which started around the prescription drug issue with opioids becoming more prescribed, then starting to see pill mills, then starting to see heroin use as pill mills shut down, and then starting to see synthetic opioids like fentanyl right now. And this perspective, I think, that I bring is interesting because it allows me to both go into the ER, which I was in 12 hours yesterday, seeing patients, 6 of which had opioid use disorder or therefore withdrawal or for an overdose acutely. Those 6 patients, if I go back 10 years ago, I would have offered life-saving treatment for the moment, but would have done nothing for the future. And the patients who were in withdrawal, I really would not have done much of anything at all. Where organizations like Jennifer are leading us, where we're at right now and moving forward to, is a place where now we try to get those people some type of treatment and help.
So one of the things I've read a lot about is access to treatment. What are some of the steps we can take to increase access to treatment for people who have substance abuse disorders?
Yeah, that's a great question, Ernest. And I think one of the things I've really learned over this last decade or so is that we have to be willing to meet people where they're at in the continuum of substance use. And so some of that means harm reduction. Some of that means, on the other side of the coin, opioid overdose reversal or management of the acute overdose. And sort of in the middle of all of that, to take the patient who wants to not use opioids and put them into some type of program with medications to try to not use opioids. What we've seen really change and open up, and this is part of sort of federal administration law changes as well, is the ability for people like me to utilize a medication called buprenorphine, or Suboxone is the brand name, and even use it in the emergency department, and then try to get people on that medication as they leave the emergency department and then into a treatment facility, either as an outpatient or inpatient, depending on where they're at in their care continuum.
So is one of the keys making that drug more available, Dr. Wilson?
It absolutely is. There's a few keys right now that we have to keep on turning, right? The keys are in the door lock, but they're not fully turned yet. So a great example right now is some of the leftover both state and federal regulations around places that can utilize, prescribe, and give both buprenorphine or methadone. There's a lot of, outdated, basically things that just weren't we were giving a lot of buprenorphine in the ER that are still there in the federal regulations and also in the state laws. Those things are changing slowly, but they need to change more rapidly.
You know, you mentioned some legislative action, Jennifer. I know there's another bill that's getting great consideration in Tallahassee, and it's going to allow for more people to qualify as peer support specialists. Talk to me a little bit about that and why it's important to have peer support, people who've also gone through this.
So along with that storytelling of kind of destigmatizing substance use disorder is also telling one story as a means and connecting with folks who have made it. You know, not all overdoses end in death. A lot of people go on to revive and recover. We need to get that out there and those stories out there. And peer support specialists not only have that story to tell, they also have the experience of visiting places like the emergency department where Dr. Wilson works, being incarcerated, going to jail. Jails are using peer support specialists. Law enforcement agencies are using peer support specialists. Instead of having a detective show up at your house 24 hours after you're brought back from a fatal overdose with Narcan, they realize that wasn't the most effective strategy, that somebody who's just overdosed is a little freaked out if they see somebody in a police uniform or a sheriff's officer at their door. And so they're sending peer support specialists or plainclothes behavioral health support specialists. And these folks, it's their job to connect those who are getting onto the path of recovery to recovery resources. So either that's an inpatient program, that's a intensive outpatient program, or simply to a recovery community organization and a 12-step program. There's many ways of getting treatment and recovery. And these individuals are uniquely positioned to help to connect with those in this very vulnerable state. I mean, they're actually so effective that even the maternal child health programs for mothers who are dealing with substance use disorders are considering pulling in moms to be these kinds of peer support specialists to pregnant mothers who are trying to kick their habit or deal with their substance use disorder. And I love that Dr. Wilson really emphasized the fact that this is a chronic disease. And so having somebody who can walk with you along the path and give you, from their own experience, what they did and connect you to those resources, so very important.
The recovery ebbs and flows.
Yeah, and as we think about this as really a continuum, that's a circle, that's a 3D structure that people are moving, and what we have really tried to do is create spaces where anywhere you are in that journey, there's a place for you to go for treatment. And I just want to echo how important the peers are. You know, if you go back a few years ago, I was not yet understander of the data around peers. I did not quite get it yet. Let me just say that as working in an emergency department and running an emergency department, you think, oh wow, so you want to bring people who've had prior issues with opioid use disorder and put them around other patients using opioids in an ER, this seems a little, unsettling. The data, counterintuitive. The data, though, was so crystal clear. My team, kept on showing me the data, and they were. I'll tell you, Ernest, I believe in the peer model so much. Just as a real example, I've given up my office in the ER to my peers because I want them there so badly. They need a space to be there. When we started at Tampa General the first what we call MAT program, or MOUD program, which is a medication for opioid use disorder program out of an ER in the state of Florida, and we did that with Central Florida Behavioral Health Network. And so to do that, we brought in peers. As we started that program, our peers weren't there yet. Our engagement, our enrollment in the program was not very high. We now have over 600 people who've gone through our ER-based MAT program, really all because of the lived experiences and that testament to our certified peer recovery specialists.
Wow, that's terrific. Another aspect that we haven't talked about yet, I know Live Tampa Bay is focused on this, is trying to get business leaders and faith leaders involved. How can business leaders help, Jennifer? And why do they need to be involved? Why do they need to be concerned about this issue?
One, this is everybody's issue. Second, the majority of the folks who are dying are found within that prime workforce age group, that 25 to 54-year-old age group. That makes up 76% of the overdose deaths are in that age group. So it's our workers. It's the people whose labor moves our economy forward in the Tampa Bay region. And finally, it's just the right thing to do. I mean, the new front line, we can't wait until it's a medical crisis or a criminal justice crisis. We need to move the front line up to where employers are skilled and educated and involved, and where their employee assistance programs are smart enough to help folks with substance use disorders deal with their disorders, where their time off policy mirrors the language that they're using, saying, I get it. I get that addiction is actually a chronic disease, that it's a substance use disorder like other disorders, and I'm going to treat it as such, that their insurance policies match that. I mean, when you consider how much time we spend focus at the workplace, making sure that those places are places that help us move along a path of recovery if that's what we need, or that promote behavioral health, is so very important. And to our business leaders' credit, they have come on board. I mean, Tampa Bay Business Journal just came out with their 100 most influential people. 11 of our leaders were on that list. Wow. These are our industry leaders who are getting there, and not necessarily are just healthcare systems, although I'm so grateful to have folks like Tampa General Hospital, Florida Blue, and others on our leadership committee, but people who, banks, the Rays, all sorts of industry leaders are showing up to the table and saying this is an issue that we all need to be concerned with.
Yeah, so let me just close, as we have about a minute left. Let me close by asking both of you, how much can that involvement help us deal with the stigma of substance abuse disorder? How much can it help to get the whole community focused on this issue? Dr. Wilson.
Yeah, what I really appreciate about the involvement of business leaders, community leaders, is it really gives credibility to this approach. I think seeing so many big names, big associations, big organizations step up and understand harm reduction works and understand we're trying to save lives really gives the public some time to say, oh, okay, I think this is really the right public health approach, and that is appreciated.
Jennifer, you had a last word. How important is it to deal with the stigma associated with this?
It's foundational. I mean, honestly, all the changes that we make are going to be dependent upon ensuring that folks no longer have that stigma against those with substance use disorders. Hospital executives can make policy changes, but those implementing that, unless they've dealt with their own bias against those with substance use disorder, it's not going to really take hold. Legislators can pass laws, but if the people who are enacting those laws don't see sick people but see bad people, we're not going to see the changes on the ground that are so vital to saving people's lives and helping people pull their lives back together so that they can be thriving, successful individuals in our community.
All right. Well, Jennifer Webb, Dr. Jason Wilson, thank you so much for being with us today. For Live Tampa Bay, the opioid crisis is a health issue and a moral issue, but it's also an economic issue. Here to tell us why more businesses are taking an interest in the opioid crisis is Tampa Bay Partnership CEO, Bamitra Simmons. Bamitra, how are you?
I'm doing great, Ernest. Thank you so much for having me.
Well, we're glad to have you. And tell me, why has the partnership and a number of businesses in the community taken an interest in this epidemic?
Great question, Ernest. I mean, on the surface, this would seem like that it is a health issue only, but it's not just a health issue. It's a quality of life issue, which makes it a business issue. We want our members of our and residents of our communities to be healthy and able to function properly so that they can go to work and focus on their jobs and have, economic mobility for themselves. And what we've seen from this crisis is that the more residents in the Tampa Bay region that are affected by this, the more that interrupts them from an economic standpoint.
You've made that appeal to business leaders. How have they responded? Are they interested in helping with the crisis?
Absolutely. I mean, this has been a focus for the partnership now for a couple of years. And just in the last 30 days, we convened a group of about 90 community leaders, business leaders, healthcare professionals, faith-based workers, not-for-profit, to talk about this issue and this issue alone with the simple but lofty goal of reducing the number of deaths in our region due to opioid use and abuse.
You know, a big thing we've talked about, Bamitra, is how COVID-19 has changed the impact of the opioid crisis. And we know in the last year and a half, those changes have had a disproportionate impact on communities of color. What have you learned in looking at some of the research numbers about that impact?
Yeah, great question. So what we've seen over the last year and a half is that, as I mentioned, this is becoming an everybody issue. Historically, the opioid crisis was seen as something that was rural and white, and unfortunately, that's just not the case anymore. We saw triple-digit increases in percentages, particularly in the African American and Latino community as it relates to opioid use over the last year and a half due to the COVID, during the COVID-19.
All right, and as we wrap up, let me just ask, how confident are you that this collaborative effort can help lead us out of the fog of the opioid crisis?
I'm very confident. I'm encouraged by the players that we have today, everyone's passion for reducing the number of deaths and understanding that, it's going to need to be a collective effort between business, community, and government in order for our community to win on this issue.
All right. Hey, I hope you're right about that and we are able to impact this crisis. Bamitra Simmons, CEO of the Tampa Bay Partnership, thank you so much for being with us today.
Thank you for having me, Ernest.
Coming up, I'll have some closing thoughts on the opioid crisis. Let me speak correctly. Those battling addiction suffer from substance use disorder. Don't mistake those words for some sort of 21st century political correctness. Experts properly use the term to describe someone with a mental disorder that affects a person's brain and behavior, and that disorder impairs the person's ability to control their use of a substance, be it alcohol, medications, or in the case of today's subject, opioids. The terminology helps frame the challenges society must address with this crisis. We must erase the stigma attached to this disease, and we must get off our moral high horses and fight for the systemic change needed to save lives. It starts with pushing for greater access to treatment for those with substance use disorder. The pandemic has curbed that access, but as the COVID cloud begins to lift, let's help patients fight through the fog and get the help they need. Let's help them win out over the isolation and stress brought on by the pandemic. And let's remind people invincibility exists only in the world of comic books. Let's raise the awareness about the dangers of purchasing street drugs laced with the phantom known as fentanyl, and help them fight the notion that the fleeting reward can be greater than the risk. When I listened to Sandra Sierra describe the loss of her son, I couldn't help but think of my own 3 children and the pain I would feel if they fell victim to an accidental overdose. That thought tears at my heart. We shouldn't wish that fate on any parent, and we shouldn't ignore the very real threat posed by this epidemic. Everyone needs to heed the warning. Everyone needs to realize that Sandra Sierra's loss is a loss for all of us. That's all I'm saying.
Premier Eye Care is a leader in national managed eye care with 4 million insured members nationwide through its network of optometrists, ophthalmologists, and specialists. Recognized for best practices in delivery of care, associate engagement, and commitment to the community. Premier Eye Care is proud to support That's All I'm Saying with Ernest Hooper. For more information, go to premiereyecare.net.
Our motivation every day is the people around us in this community and making better.
Workforce development, healthcare, education.
Getting out there and making a difference in the lives that need it the most.